Hello, good morning or good afternoon, depending on where you are. Welcome to the Power Tools webinar series. My name is Danae Schmidt. I am the Member Relations and Operations Manager with USBC, and I'm so glad to welcome you to today's session. The Power Tools series is organized as part of USBC's training, technical assistance, and capacity building support for our network of state, territorial, tribal, and community breastfeeding coalitions across the United States. This series occurs on the third Wednesdays of odd-numbered months from 2 to 3:30 p.m. Eastern. Access to these webinars is free and open to all Breastfeeding Coalition leaders, members, breastfeeding advocates, and really to anyone involved in forming or leading nonprofit organizations in the maternal and child health field. Webinar announcement emails are sent through USBC's Coalition's announcement list. If you're not subscribed to this announcement list, we invite you to visit the Coalition's Learning Connection located in the USBC website, where you can subscribe to the forum to receive key updates and announcements from USBC's headquarters. We do want to just remind everyone that a USBC login is required to join the Learning Connection, and it only takes 1 minute to create. As you may know, we have streamlined access to this series, so you only need to register once to have access to all future sessions. Once you're registered, you'll receive reminders from the GoToWebinar system with your unique link to join each session. We understand that not everyone can make it to our live sessions, so we do record all of our webinars. Slides and handouts for today's session can be found on the Power Tools webpage and has also been chatted to you. You'll be able to find the recording of today's session on the webpage or in the Coalition's Learning Connection, along with our other archived sessions. The handouts for today are also in the handout section of your GoToWebinar panel, so you can also download them from there. So here's how you navigate to the public webpage to download those slides. Once you go to usbreastfeeding.org, you simply hover your mouse over the Webinars tab and select Power Tools Webinar Series, and that will take you directly to our main webpage for this series. For today's session, all participants are in listen-only mode. Our presenters will be pausing periodically throughout the session to take questions, and we'll also have a general Q&A segment at the end. So we encourage you to type in your questions using the questions box all throughout today's session, and we'll be sure to read them to our presenters. And here's how you do that. Go to the GoToWebinar control panel on the right of your screen. If you don't see it, it may be minimized. Just click on that orange tab and it will pop back out. If you scroll down below the audio section, you'll see a tab for questions. And when you click on it, it will open up a box for you to type in. If you have any webinar related problems, please send an email to coalitions@usbreastfeeding.org and one of our staff members will assist you. We do recommend connecting by phone rather than mic and speakers. The mic and speakers are connected to your Wi-Fi connection, so if it gets a little wonky, you may lose audio. So if you are experiencing audio problems, we do encourage you to call in, try calling in before emailing. Okay, and that brings me to today's topic. Alameda County Breastfeeding Coalition Organizing for Effectiveness. This session is being presented by a tiny but mighty coalition from California's diverse San Francisco Bay Area. Alameda County Breastfeeding Coalition co-chairs will describe how their community of breastfeeding advocates have grown stronger and more effective by using tools such as community needs assessments, results-based meeting agendas, leadership sharing, and subcommittee formation for breastfeeding equity and special projects. This award-winning coalition will share their journey of organizing for effectiveness step by step to encourage listeners to embrace challenges and maximize their coalition's relevance. I am delighted to introduce today's presenters. Jeannie Kettles is the WIC Regional Breastfeeding Liaison, or RBL, for Alameda County. As RBL, she facilitates partnerships between 7 local WIC agencies, hospitals, community healthcare centers, public health programs, and other community partners to improve access to WIC and quality breastfeeding care for WIC-eligible families. Jeannie served most of her professional career as a midwife, has been a certified lactation educator for over 28 years, and IBCLC since 2016. She holds a master's in integrative health and applies her experience in integrative team building skills to the development of culturally responsive programs in which mothers and care providers feel empowered to thrive. Our co-presenter, Tanya Lang, has supported breastfeeding families for the past 14 years as a La Leche League leader in Oakland. Her public health experience includes positions at the Centers for Disease Control and Prevention and Asian Pacific Partners for Empowerment and Leadership. Currently, she co-chairs both the County Coalition as well as the Asian, Southeast Asian, and Pacific Islander Task Force, also known as ASAP. Ms. Lang received her MPH in Health Promotion and Disease Prevention from the George Washington University School of Public Health and Health Services. She is a certified health education specialist. And with that, I'm going to turn it over to Jeannie and Tanya.
Thanks, Janae. Good morning, everyone.
Okay. Alrighty, and you should be the presenter now.
Okay, great. Let's see. We're going to talk a little bit about that organizing for effectiveness. I wonder why it's not advancing. Let's see. Okay.
There we go.
So I'm Jeannie.
And I'm Tanya Lang.
And we're going to talk first just from the formation of coalition. We know that you are we talk about ourselves as being tiny but mighty. There's lots of different types of coalition formation, and I find it interesting. The definition of coalition is one of them could be the act of coalescing, like the coalition of water vapor into raindrops. And I like that idea for coalition framing more than just that kind of, the alliance between parties and things, although that's true too. So what we hope to talk about today is maybe instead of a coalition member, thinking about how to increase involvement and be engaged, we talk about the networking and how to make it more inviting. And but yet we still need to think about structure and organizing for action.
Right. And oftentimes, so we're looking at power tools that we can use in our work. Often we, as you know, we don't even know what we don't know. But hopefully we can talk about our process and shed some light, at least for what worked for our coalition.
Yeah, we were talking about this as we were putting this together, and it really reminded me of the moment in my life when I went downstairs. I was a teenager, and my dad, first of all, there's 6 girls in my family, right? No boys, just my poor dad and my mom. But I went down to his workshop, and there's all these tools everywhere, every single imaginable. And I realized in that moment, like, I don't know how to use any of these tools. Like, I wasn't taught. It wasn't part of the culture in which I was raised to be taught how to use these things. So we realized that when we come together in our passion to be, our breastfeeding advocacy and the work that we do, many of us don't have maybe formal education or training, or maybe we learned it in school, but we never really applied it. And so we hope to kind of, break it down from that, can you do it yourself to...
Right. So what we're going to do through this presentation is just talk about kind of which tools we used to organize our coalition and, just continuously work on improving things. We're going to talk about the who, what, when, and how. And hopefully, we can present the information in a way where you can also imagine, like, how can I maybe use these tools in my community, so you can actually do this all yourselves.
Yeah, we're still imagining what we're doing.
Right. I mean, we'll be talking a lot about the projects that we've done as a coalition for the last several years, but we also want to make it very clear that this is all just a work in progress. So right. Everything that we present, nothing is ever truly done for us.
Right. But you can do it too. So Alameda County, for those of you not familiar, we're that little heart in the center of California. It is a very, very diverse populace, some rural areas, but mostly urban, over 1.5 million. Alameda County is actually one of the most diverse counties in the country. And so this is just an image of most recent data. It's, just under a third of people who identify as white, about a third who identify as Asian, and that's many different cultures and languages. And actually, even though this data reflects that, a little over 10% identify as African American or Black, that's actually a high percentage population proportionate to the community when you look at different counties. And I can talk a little bit about why that matters. And then we also have a very rich, very diverse Hispanic Latino community as well. We have a lot of non-U.S. born mothers. So we put up some data slides here as one of the power tools we'll discuss. In the center is all of Alameda County. You can see that we're higher than the California average. I don't know how this compares to your particular counties. And then it gives us a sense of, like, for example, within Asian, we also have data that says the number one country of origin for Asian is actually India. And right behind that is China. And of this data that's represented, that's a little over 1,500 each from them, as well as Vietnam and Korea and others. Latina is, many different cultures, as I mentioned, as well, and Pacific Islander. So we also have a lot, when we look at data, the mothers who are birthing, many of them are first-time mothers. And we, look at that across some of our data sets. We look also at what kind of, through access to care, through their insurance types. This is also sometimes used as a proxy of income need, but also lets us know how we can access them. In Alameda County, because we have such a need for it, our safety net services are actually shared among 8 community health care centers that in some ways represent some of these different groups. For breastfeeding data, this is an example. We look at breastfeeding data to really look and sort of drive our work. So who is our population and what's going on? This data set here is from the in-hospital initiation data, 2017. That comes through the state. The data source itself is the newborn screening exam. So this is done within the first 24 to 48 hours of life, and they ask a question about the feeding method. So it helps us derive an approximation, because there may still be supplementation or a different change in feeding before discharge, but it gives us a kind of an approximation of what breastfeeding initiation is happening. And this slide demonstrates a couple of things. So we're looking across how people self-identify racially, ethnically, and it gives us, in the light blue is the exclusive breastfeeding rate from the newborn screen, and then the dark blue is the formula rate that's at the very top of each column, and that place in the middle is that difference between any breastfeeding and exclusive breastfeeding, which says the mother's breastfeeding, but there is some element. We don't know how much supplementation. We don't know if it was water, sugar water, or if it's formula or why, but it gives us kind of a sense of what's going on in the hospital practices. And we do this by the percentages within an ethnic category as well as the numbers, because you could look and see, wow, 25% Pacific Islanders. It's a smaller population, but it's still important to know when we start doing outreach and develop things, strategies, is there a disproportionate effect? When you look at the numbers for Asian and for African American, well, 18.6, 18.4, pretty similar, but look at the numbers, and then you also have to divide across what are some of the other barriers, including language and others.
Okay, so we're not going to spend a whole lot of time on, the data breakdowns, but we just want to point out a few things. So looking at duration by race and ethnicity, the stars represent the Healthy People 2020 benchmarks. And so we're breaking this down by race ethnicity. You see that white, if we look at the white, that's the group that's pretty much the closest to our benchmarks. I want to point out in particular the Asian and Pacific Islander. You see a huge drop off by 1 month, and that's what we're seeing in our community. There's a lot of early supplementation, especially for that group. Looking at duration by prenatal health insurance, we see disparities there as well, right? Medi-Cal versus private. And then also by income. So this is not super surprising, but, just wanted to point out that, we have documented disparities in our communities.
So let's check in with that. We just talked about kind of one of our power tools that we work with is data and looking at initiation data. That duration data comes from the MIHA, which is the Maternal Infant Health Assessment, which is a surveillance tool implemented through the state of California. But maybe, Danae, you can help if there's any questions people have about data sources. So we looked at population data and breastfeeding data. We looked at a couple of different things. Anyone have any questions about data?
I don't see any questions right now, and I wasn't sure if I heard where your sources for the data were from.
So the in-hospital breastfeeding data is from the California Department of Public Health, puts together reports for all of the hospitals and by county, by race, ethnicity, and that comes from the newborn screen. So at the point of time that the baby is screened for those congenital potential anomalies, the feeding method is documented, and so that's our initiation data. The duration data comes from the Maternal Infant Health Assessment, the MIHA. That's a surveillance tool implemented by the California Department of Public Health. It's similar to the PROMS, the Pregnancy Risk Assessment Monitoring Survey. And then the other data about population, first-time moms, foreign-born, that's all from the vital statistics. So that's all our county vital statistics data. Okay, so everybody can drill down on data. That's great.
All right. So, and if anybody has any questions later on, we'll be stopping periodically just to do check-ins and take questions. So you can definitely ask later on. So really quick, let's talk about Alameda County Breastfeeding Coalition. So we were established in the late 1980s. We are very public health focused, but we are not a 501c3. We have a very diverse membership. So we have WIC represented, First Five, Public Health Nursing, La Leche League, childcare, doulas, our fatherhood initiative, and private practice LCs. It's very diverse. We're also not mostly IBCLCs. We come from very different professional backgrounds, and we do not have any dues. So we are all volunteers, and we also have no money.
You can relate, I'm sure.
I'm sure everyone can relate to that.
So back in the late 80s, when the coalition was formed, there was, within the maternal child adolescent health plan, public health departments have to do their community health assessments periodically. So around that time, the exclusive breastfeeding rate was at about 50%. And even over the course of 10 years, that didn't move that much. And there was a lot going on in development around that. But we were falling short of the Healthy People 2020 goal. We were able to look at data that showed that, yes, there were significant disparities even within that in 1997. So we started to really look at that. And also at the duration data that was available, it was pretty low. So moms were starting off and they were kind of joining that movement that was going on to some extent. But we were really falling short of our goals for initiation and duration. By the time, the next assessment came along, there was a long laundry list of all the things that we could do because exclusive breastfeeding was up, but it still was falling short of Healthy People goals, which we like to try to, achieve, but still no pattern change in duration. And in fact, at the time that was the Healthy People 2010, we were still pretty short of that, and there was no way moms were going to make it to that 6 month. The groups that were identified at risk, in particular, were African American women, low-income women, and WIC participants, and women who gave birth at public hospitals. So this was these kinds of data analyses within our public health community assessment gave us, sort of some areas to work with. But our coalition was, I don't know, really quite organized to achieve that. But at that time, at the turn of the century, there.
Mm-hmm. Right. So, given all this information, let's look at the mission of our coalition. So our mission is to redefine breastfeeding as the norm for infant feeding, create an environment that promotes and supports breastfeeding through education, collaboration, and partnerships among breastfeeding advocates, and promote breastfeeding integration throughout the healthcare system by bridging resources and services for all families in Alameda County. Okay, so what was that? That's a lot of words.
That's a lot of words.
That's
very public healthy. Very public healthy.
Very public healthy. It's a lot of words, but what does that really mean?
Right. So the coalition was established, right? We had somebody within the maternal child health who is trying to lead up efforts. We could identify areas to work with. We had this mission. So let's pause and take a little check-in. Let's talk about mission statements and looking at that. Any questions people have about mission statements?
I don't see any questions about mission statements. There was a question about your membership. I noticed that your membership is very cross-sectoral. Can you give any tips on how to diversify membership?
Oh, we will. We are definitely going to talk about that. Yeah.
Okay.
Let's go back. If we don't answer your questions at the end, if we don't give you some good ideas, then we'll definitely take that question at the end. But that's really important.
That's a really big part of the work that we've been doing here.
Yeah.
We do have one more question that actually just came in. Do you do your mission statement work during a coalition meeting?
Well, actually, it's great that you asked that because
good question.
we're not resonating with that mission statement. We did, and we'll talk about, we did do a survey of membership, and people at that time really liked the mission statement. But as we go on and we're trying to put it more out there and really say, we believe that everybody should just be able to roll it right off their tongue, right? And we think it's a little clunky. So our steering committee, which we'll talk about a little bit later, is actually working on drafting a simpler version, and we're going to put it to the membership in our May meeting and kind of get their input and vote on that and see if we could find something that's a little bit more user-friendly.
Right.
Awesome. And there was a second question that said, is that what you stand for regarding to your mission statement? It sounds like you just answered that, and we'll answer that throughout the presentation. So,
right. I mean, I think we stand for all those things, but really we want to create something that's more of an elevator pitch where we can describe the coalition and the work that we do in a much simpler and, shorter way as we're doing more and more outreach.
Any mom or dad should be able to say what it is. Right. So that's what we're thinking. Okay, so moving along. Are we accomplishing our mission?
So we had surveyed our members back in 2013. Are we accomplishing our mission? Basic question. 85% said yes. And the things that people cited as examples were World Breastfeeding Week trainings and celebrations that we did every August. We had breastfeeding peer counselor trainings and a hospital pump loan program. We also participated in the Guinness Book of World Records Big Latch event in 2002, where we set the new Guinness World Record.
People were proud of that.
For a number of people, number of babies latched on at one time.
And then the hospital pump loan program. So at this time, I came into the coalition around 2010 when my position started with the Regional Breastfeeding Liaison. And over the course of those years, what I witnessed was kind of inconsistent participation, a very small group of committed leaders, but it was very WIC heavy. So we have 7 WIC agencies in Alameda County, and WIC was kind of dominant in the proportion of membership. We did have some hospitals, but we'll talk in a few minutes about maybe why the meetings were not as inclusive for that. But just to kind of go back to the data. So, again, are we achieving our mission? You work with what you have, right? So we had a small group. We were doing these things. Now, we are not responsible for the increase along the way. There's social changes. There's programmatic changes. There's all kinds of stuff going on. But we were seeing that things were improving based from how it was before. But we had really the question is like, can we do more? Like, what are we doing? Really, can we leverage the fact that we are a county coalition, a public health coalition, to really support, maybe align better with the community needs? So that 2013 survey that Tanya mentioned was our own organizational needs assessment. We had a change in leadership going on, and we wanted to appeal to a more diverse group and really, kind of redefine what our membership was. And then we also really wanted to get serious about what are the needs in the community and how are we meeting it.
All right, so I just wanted to talk a little bit more about the results of our member survey. So things that members thought we were doing well or the reasons why members were participating and thought we were doing well. They came to receive and share information and collaborate and network with each other. When we look at, so that's for the active members. We also asked, for non-active members who don't participate, why are you not participating? So people cited lack of time and their schedules, but also lack of meeting structure. Some of the things that we wanted to do moving forward after that was establishing leadership. So kind of clarify clarify the descriptions of the leader roles, have a formal nominations and voting process, having a clear and organized agenda, manage the time during our meetings, just put in a little more structure, making the agenda clear, organized with ample time for each section, and then also sticking with it. So, really kind of like basic things.
Because you can imagine a bunch of passionate women getting together when there's no structure, and the conversations could run right on and on and on. So we definitely needed to look at how to keep that passion, but channel it well. So
taking those results, we did, taking those results back to the membership, we had several meetings and discussions to brainstorm a new structure. We did a doodle poll for a new date and time for our meetings. One thing that we heard clearly was we wanted to move to quarterly, because in the past the coalition would meet about monthly?
Yeah.
And that was just a lot of time, and it wasn't a great use of people's time. We wanted to talk about diversity and representation and, targeted outreach. We also wanted to talk about leadership. So, we created a co-chair job description.
Yeah, how is it just always the same person that's willing to, the one that doesn't step back when everyone steps back, right? We were looking for an image of that, actually, because that really kind of summed up what was going on.
Right.
But how do we really create that clear, defined, and support different leaders in there?
Right. Other things like creating a coalition flyer, which states our mission, what do we do, when do we meet, a contact person if people have any questions. And then also looking at our meeting agendas. We'll show in a bit kind of what an example of our old agendas, but just creating even a new agenda template.
So there was a regular structure that would always follow that structure with some sort of time. So let's look at that agenda. This is a really important power tool. So this is an example of what an old agenda would look like. And you could see where people would be like, okay, 2 hours, there's no definition. It was kind of like just a reminder that the meeting is happening. And even that sometimes was, kind of last minute and structurally. This is an example of what Tanya was just showing at that time when we were responsive to the survey. This is our first, restructuring so that we'd have our opening, right? So we'd start every meeting, we'd have some sort of opening. In this particular meeting, we had a panel presentation about different breastfeeding support groups. And then we had our different subcommittee reports and community updates. And then we always have a section that's sort of like, what's the hot topics, what's going on. This is a current example of our agenda. It's actually called a results-based agenda. Alameda County Public Health Department is becoming an accredited public health department, and they use results-based accountability, which is also our state of California is an accredited public health department, and they use results-based accountability more and more. But it's a way of really keeping it simple, staying away from the jargon, and so people know when they come to a meeting, like, what are they there for? So what we found a lot was that people were not coming to a meeting because their supervisor wouldn't sign off on them for the time, because they didn't know what's the benefit to us. Like, what are you going to be doing there? Not just talking about breastfeeding, but what's actually going to happen. So each meeting agenda has, the date and time, but also the objectives of the meeting, the overall objectives, and then point by point, what we're going to cover, when the breaks are, who's speaking, and what the process is. This is, at that time when we made this big transition, we wanted to thank the outgoing leadership because they did a great job and they were in there for like the long haul and putting this together. So, but this is also indicative of another power tool that I hope you all leverage, because we're all working so hard, is to celebrate all that you do. It's really important to take those moments and mark those transitions and give thanks to the people that are doing work and find some way to recognize and work together.
All right,
so let's check in. We talked about organizational or programmatic assessment, so our survey, how we put that out. We actually, I think we forgot to mention that we had an objective, like a professional facilitator for the discussion. So we had the survey results, and then she presented that. She came from our county hospital, who is a very strong member. The current co-chair, Michelle, was part of the Alameda Health System, Highland Hospital, which is a baby-friendly hospital, and they were able to, get their staffing resources to help us with that. So that was another part of the survey as well, looking at that. And then we talked about structure and agenda. So let's check in. Any questions, ideas?
Yeah, so one question is, you just mentioned some key partners. Who were some other key partners during this restructuring season for Alameda County Breastfeeding Coalition?
So let's see. I want to make sure I understand the question. So at the time, let me think who was mostly active at the table. We had, as I mentioned, Michelle, who was one of the co-chairs, was from the hospital. We had First Five. We had Alameda Alliance, Linda Ayala, who was one of our co-chairs who stepped up. So that's our Medi-Cal managed care system, or one of them. And WIC, we had some clinics that were involved. So it was, the members sort of represent themselves less than like a big organization. We didn't go after like a funder to support this because we had resources from within. So Highland being able to support that facilitated session was really helpful. And then we all just did the work. I brought in the results-based agenda stuff. We had, everybody just worked together to kind of bounce it off each other and see what is it that we wanted to include. We had just open discussions. Does that answer the question?
Yeah. That's great. Another question is, did you ever have moms join your coalition, or is it structured around professionals joining?
I'd say it's pretty much structured around professionals. Right. They're always welcome, and I'd say maybe, I don't know, it's kind of hit or miss. Sometimes we have one or two moms. We encourage people to invite mothers. We don't have childcare, but babies in arms are welcome. And we'll share, we did do, like within a community assessment, which we'll talk about next, we did provide childcare, and that did help get more moms to come. But I'd say for the most part, our coalition meetings are predominantly a wide array of professionals.
Right. I mean, we have put together some events that are kind of more like community oriented, especially during World Breastfeeding Week. Some years we'll do more kind of like a celebration and a social, where we have more families there. Like we've done one at a park at the San Leandro Marina, that kind of thing. So, it is a conversation that we have on an ongoing basis. Like, how can we involve more parents? But, for the most part, what we see at our meetings and on our steering committee, it's mostly professionals or people who are working in the field.
Yeah, we're trying to even make the case for the peer counselors to come, because a lot of them, there's no funding in their funding stream to provide for meetings. And so we try to make the case to have some sort of representation, so it's not just the supervising IBCLC or manager, so we can kind of, again, be that much closer to what's going on with moms right now. And I'd say that we also get a number of student lactation consultants coming through. So I'd say every meeting has one or two that are there to meet the requirement for either their CLE or their IBCLC to participate in a meeting. And sometimes they stay and they get involved with stuff. So that's kind of cool.
Great. And then one last question is, would you be willing to share a copy of the membership survey that you distributed?
I don't think I have that anymore because the facilitator had that, but I can share some of the key questions. But I don't have the actual copy of the survey, yeah.
Wonderful. And we can post that on the CLC as a resource.
But also think about, like, when you do it yourself, like you saw some of the questions that we asked, which is like, what do you like about? Are we accomplishing our mission? What do you like about meetings? If you don't attend meetings, is there a barrier? What would you like to see? Like it was pretty simple. Let's put it that way, because people don't have time to fill out a whole bunch of survey stuff. But they talked, and then they asked, like, where would you like to see us go? Like what area would you like to, and that's where really a lot of them talked about organizing a little bit better.
Mm-hmm. Great.
Okay, moving on. So around this time, this was back in 2014, Alameda County was going through its periodic, again, you saw those reports before, the community health assessment, and they were having a series of different community discussions. So we were able to advocate with the director of the public health department at the time. Actually, it was the deputy director, Kimmy, who's now the director. We said, we really don't see breastfeeding included in some of these outreach, and we'd love to try to, as a coalition, organize community participation to include that in the community health assessment planning. So this is really intentional. This flyer on the left, this YAP, that's not our idea. That was how they framed their, your assessment action project. But we, worked within their structure. And then we had the woman in the center there as our professional facilitator who came from the county, who walked us through the questions. And basically, I can share those questions with you for that, because it was the same for any of the groups that had the assessment participation. But for ours, it was breastfeeding tailored. What is your definition of a healthy breastfeeding community? What would you like to see? What major concerns, problems, or conditions do people in your community face in regards to breastfeeding? And why do these issues exist? What is already in place that's working to address your visions, concerns, and issues and to improve breastfeeding health in your community? And what visions, concerns, and issues discussed are most important for the public health department and for community partners to address to improve breastfeeding health in your community? So basically, sort of like, when we say healthy community, healthy breastfeeding community, how do you see it? And that was a really interesting, vibrant conversation. And then, really trying to hear what are some of the concerns, and different groups might see it differently. We also found some common ground. It's really important when we think about building on the assets that we have. So we are a resilient community. So what can we build on? And then we asked them to rank. So we gave everybody sticky dots, and we had them rank when we came up with a list of things. And you could see we had 2 recorders going the whole time during the conversation. So we had the facilitator, and then just to keep really kind of capture the stories and what they were saying, they were writing like fiends. I think their wrists fell off at the end. They were writing everything down. And then we put that all together. And these are the
results. So I'm not going to sit here and read every point to you, but again, this was in ranked order.
Right.
After pulling all the information together, all the feedback, this was the ranked order. But we also want to note that this is not linear.
Right.
So we're not taking this list and going, okay, number 1, what we're going to do from now, at this point is we're going to look for funding streams. The way we, this is just a list that kind of helps guide us in terms of, where do we move forward from here as a coalition? In terms of what we actually ended up doing and what we do or what we're planning for in the future, we're just pulling a bunch of things together. It depends on this list of priorities, right? It depends on who's available. It depends on what resources kind of pop up.
And we'll give some examples of why we, for example, jumped to number 7 at the time, and why we moved around. But at least we knew what's the body of work that is important, and we had a very rich, engaged discussion about it. All right, let's check in. We talk about community assessment, seeing if you are, level and aligned with your community needs. So any thoughts about that? Any questions?
Yeah, one question, two questions. How will consistent messaging be assessed, and is there a tool for this?
So assessment is a really interesting piece, because if you did this kind of like a pre-post, like, okay, we do this campaign, here's where it was before, here's where it's after, but basically what we do through our participating members and through the different work that we're doing, say for example my work as the regional breastfeeding liaison, working with the entire county wide of the comprehensive perinatal services program, I know that program really well. People come to our coalition meetings and they can share, but we've had workshops and sessions where we really delve down into what are you saying, how are you saying it. We've done different projects where we've worked with particular community healthcare centers to work with the midwives and physicians there to streamline the key messages. So we've done a lot of promotion campaigns. We had one with First 5 where we knew the evidence base from the research, which says moms need to know about the importance of exclusive breastfeeding, why rooming in is important at the hospitals, why they're promoting it, how that helps breastfeeding, skin to skin and the value of that, and then why not to give, pacifiers or other things like that and get that early assessment. So just starting there and promoting it unilaterally, like throughout everyone, that's one way that we think about consistent messaging. We've also had people bring copies of what they use. We've done some site visits and we've seen some stuff. We've talked about, like with the WHO code standards, about not having bottles and pacifiers on the handout that you've mimeographed 5 million times as being like the best way of, having education. Alameda Alliance does a great job. Our, again, Medi-Cal managed care plan that works with all of our community healthcare centers in trying to disseminate information and make that available to members. So I think it's a huge job, and you can't control everything, but I think at least knowing what the messages are, working with your partners strategically, hearing what they use and why they like what they use and what they're doing. Mostly they're like, well, we don't have anything better. But also what's literacy appropriate and things like that. So,
and also working with other agencies in the county, that maybe we don't traditionally work, like we've worked with the Safe Sleep campaign in the county, around their campaign. And what kind of messaging they have, and how does that potentially affect breastfeeding. So, if their main message is babies must sleep on their backs in a separate sleeping space and everything, how do we, and the whole point of all that wasn't to, I don't know, just say convince them that they're like,
it's a good example, because
wrong or right, but it was just finding common ground, like what, given that a lot of our coalition members are working directly with families, if families are seeing something that's kind of contrary to what, say, your home visitor is saying about breastfeeding, how do families kind of reconcile conflicting messages? So
I think, and it's key too, what people were saying, I think because we are public health focused and we do have a very kind of inclusive, focus of that, we do have maybe some one-on-one conversations sometimes. Like I'm thinking, for example, the Safe Sleep is a great example, and then invite people to come and give a presentation. But we don't want them to ever be, say, like, waylaid. Well, there'll be some passionate advocate that's like ambushed. So you have to protect everybody, right? You have to create a safe space for everybody and work it through together. We're working right now with our Office of Dental Health on some messaging and things like that, because we hear from members. That's what we said in our agenda. We have these hot issues. I hear this is being said, that's being said. So then we're like, let's look into that. Let's see if we can reach out to that partner and get our messages consistent. So should we move on?
Was there another question?
Yeah, we actually have a couple more that came in.
Okay.
One was how did you aggregate participants and ensure there was a diverse group of a diverse group present?
We didn't go to that structure. We promoted, and whoever was able to come came. And we had a very diverse group, but we didn't like aggregate like, well, I don't know, like oversample or over that. It wasn't like a structured survey. It was an event that was part of a larger promotion of events throughout the public health department. So I'm sure we missed a lot of people, but we still had a very diverse turnout.
Great. And then there was just a question to share the questions from that assessment. You said that you could share that, correct?
Yeah, I just repeated them because I read them off, so I can send that to you, no problem.
Okay, great.
So we do have a lot to cover. I'm just going to move us forward, and then we'll see if we answer questions in the end.
Okay, so we'll go back to, let's talk about leadership structure. So really, we asked ourselves, how do we establish leadership? And what is, do we even have a clear description of the leader roles? Do you want to pull up? There we go. And do we have a nominations and voting process and, subcommittees and everything? This is a photo of actually some of our past and current co-chairs.
This Linda was the one that didn't step back when everybody, when everyone else stepped back. She was our first.
Forward.
Yeah, when Michelle and Just stepped back, and Linda with our new structure was co-chair. And then Esther soon joined her to be co-chair. And so what we tried to do is have kind of like a rollover. So there's like a suggested 2-year term. People were welcome to stay longer. And then there would be some overlap. So Linda started, Esther joined, and then Tanya joined Esther, and there was overlap. And then I joined Tanya. So it kind of has some sort of continuity. That's the plan. It might not always work out that way, but for the co-chair structure, that was the idea. And then we really saw the need for a steering committee.
Right, like an advisory committee, because it's tough to just have one chair, and that bringing on another co-chair doesn't necessarily mean that we have enough people to do all the work that we want to do. And so we really wanted to get people more deeply involved in the coalition, and to also help with like planning and decision making. We really felt strongly that it can't just fall on, in the past, just one co-chair to make all the decisions and all the planning, or even 2 co-chairs.
We really had a strong value in shared leadership, and so we kind of formalized it.
Right. So we created a steering committee job description. One thing I want to highlight is that we spent a lot of time talking about what kind of representation we want to see on the steering committee. Just like we want to see great diversity in our coalition members, we really felt like it was important, if we're talking about shared decision making and shared responsibility, making sure that everyone is represented. So we looked at diversity in terms of profession and perspective. So WIC, First Five, Black Infant Health, moms, or nonprofit lactation support. We wanted to try to get good representation by geographic area. Alameda County is very spread out, very large county, as we had talked about.
Our meetings are centrally located, and they're accessible by BART. So where we meet is like right across the street from a BART station and kind of in the center of the county. But we wanted to intentionally make sure that we had some mechanism that we were saying we were inclusive.
Right. And then also representation by race, ethnicity, which I think is what most people think about when they talk about diversity and representation.
And as a proxy for culture, but it's definitely a lot there to consider.
Right. Yeah. And then so that also, the description also outlines our nominations and elections process, and also spells out, it's cut off, meeting frequency. So, we spelled out, this is the term for, this is a term of service, and also what is expected, as a steering committee. So the steering committee is 9 members total, including us 2 co-chairs. And we meet monthly.
Right.
So our coalition meetings are quarterly. but we meet monthly to do a lot of planning and like our educational calendar. So this is just an example of how we've kind of organized. We sit down towards the end of the year and just kind of plan out the next year. So we have our coalition meeting dates, and then we have our steering committee meeting dates. So we have, dates lined up for the whole next year, and then really look at what are we trying to achieve at every meeting, every steering committee meeting. What are goals for every coalition meeting? Plan out what is going to be the educational component of each coalition meeting, and then work on getting speakers and confirming speakers and all of that. We also, the last column talks about our newsletter. We'll get more into that later on. But, we plan out our newsletter. What are we going to talk about every month? And also look at what else is kind of going on public health wise, like Black Maternal Health Week. And, February was Heart Health Month.
So we encouraged everybody to wear red, and we had, now I forgot her name, the doctor that was a TED Med Talk, and but it was about heart health, breastfeeding and heart health. And we'll send you the link because we've got the agenda. But it was just, so we were able to use a free resource in our meeting room to show this education piece. And then we had everyone wear red so we could take a picture. So basically what we were trying to do is, both for our monthly newsletter and our quarterly meetings, link breastfeeding in the larger picture of, a national health initiative, because breastfeeding does supports all. Right? It is linked with all. Right. And so this is a way that we could embed education, make it thematic, and hopefully increase our relevance in what we're doing.
Right.
You want to talk about Melvin?
Yeah. So just as an example,
this
guy on our steering committee. So he works with the Fatherhood Initiative.
Melvin Calloway.
And he told the story at our last steering committee meeting about how, at our February coalition meeting, we talked about how heart disease is the number one killer for women, right? Which I think a lot of people were surprised about, and even a lot of our coalition members were surprised about.
Yeah.
And also, of course, how does breastfeeding help with women's heart health? And so he told us the story afterwards at our next steering committee meeting, how he was on a phone call with a lot of other
it was like a national call with all guys working in fatherhood and support fatherhood initiative stuff.
Right.
And he laid down all this knowledge that he had, and he was so proud of himself, and he blew everybody away, and they were coming up to him like, oh my gosh, like what, how do you know all this? And then he's suddenly the expert in breastfeeding, which he's becoming that because he's hanging out with us. So and then he really informs us and always keeps us real about how are we engaging dads in the messaging and things that we're doing. So let's do another little check-in. So we were talking about structure and representation, a little bit on a calendar and things like that. Any questions in that domain? Steering committee.
I am just scanning the questions to see if there are any new ones. How do you prioritize your projects?
Again, it should fall within our general kind of what we call our marching orders from our community and what's going on. Does it resonate with that? But then also it's the right place and the right time. So you have somebody that's willing to, provide resources, and we'll give an example later on with our breastfeeding friendly childcare, how that came about. But it's really, who's available to do what, and does it align with what our community needs? And that's how we look at it.
Right.
Yeah. As far as then the other piece is just like doing an education piece, we want to always provide in every single one of our quarterly meetings an education component for the beginning of the meeting, so it's of value to everybody who comes. So supervisors can justify that for their budget as far as training, as well as outreach and networking, and again, keeping it relevant and keeping the education rolling. And that was just for heart health. That was just because it was Women's Heart Health Month and it was February, so we just went with that. And we still had lots of other stuff that we covered in the business of the meeting.
Great. And there are no other questions at this time.
Okay, great.
Okay.
So one thing I want to touch on, and we did say before, hospitals are part of this, but what was happening back before we did a lot of this structural changes is that we saw that the hospitals they weren't coming. They started to feel that the meetings were not effective. And, you have a lot of the nurses and IBCLCs were coming on their own personal time. They weren't really with that agenda. Remember that clunky old agenda we had? It was really hard for them to justify coming and on any paid time. So around this time, the first year of my job as regional liaison, I had two counties. It was Alameda and Contra Costa. Now I have just Alameda County. But we were working with the regional perinatal programs of California, the RPPC, who they are a maternal child health program that works with hospitals around quality improvement. And so I went and did a presentation to that group about breastfeeding quality improvement. We had some new legislation that was out about hospitals implementing model policies. And they were so on fire. They loved it so much. They're like, we have to keep meeting. The RPPC lead, though, was like, well, we have these other things that we have to do. So if you guys want to do that, you have to form your own group. And so we did. And what happened here was this group was able to really dive in and focus on model policies and continuous quality improvement in what they called a really safe environment. So they, really needed to kind of sometimes have a space that wasn't involving other community partners, and perhaps, members listening on the phone can relate to a time in their life where maybe somebody who was well-meaning might have kind of pointed the finger and said, oh, those hospital nurses, they just give out nipple shields like it's, beads at Mardi Gras, right? So, and then that kind of puts people in an oppositional, they can't say, well, here's why or here's what, and how can we do to change that? So it actually was a good kind of opportunity for them to kind of break off and delve into. And we were also able to leverage then some different partners for very specific trainings. We still operated as like a liaison. We had different people come that would kind of talk at the coalition about what was going on and things like that. And now we're actually at a point where we want to bring that group back in as a formal subcommittee of the coalition. We feel like we've achieved a lot of that mission and still want to keep those values. So perhaps a separate workforce or task force to keep those values going and the training and sharing. So they shared a lot of their tools and resources and could get right down to it and not have their time. It's important for them to hear about all the other community news and things, but maybe they had a limited amount of time and they needed to get some other stuff done. And along that lines, as far as sort of like meeting special group needs and safety, needs as well, around this time, we formed a task force, a cultural outreach task force, specifically looking at the disparities with African American breastfeeding. Up in the upper right-hand corner, this lovely lady here who just recently got to retire, Delinda Horton, was really the visionary for starting this group. And we got some books, the Catherine Barber books about Black Woman's Guide to Breastfeeding, and started a group just really talking about it, just unpacking it and saying what's going on, what can we do. From that group of committed peer counselors and IBCLCs and WIC and Black Infant Health and Public Health Nursing and others, we were then able to go after some grants. So we had a series of 3 grants from Kaiser. That Oakland Breastfeeding Promotion Project actually was able to take some of the newly certified African American lactation consultants and employ them in a predominantly African American community health center to sort of change practices there, and it really took off based on the success of that work, which went from changing how they do prenatal education, starting support groups, doing a lot of training for not just the medical providers, but all of the center staff. We were also able to go after one of the NACCHO grants addressing disparities with African Americans through peer counseling. So that was the National Association of County and City Health.
County Health Officials.
County, City, and County. And that was a great opportunity. And from that, we did a lot of focus groups with moms. There's a lot here that we derived information, which then also helped us kind of give an informed finger on the pulse approach to share with the California Black Infant Health Program about perhaps revamping some of their breastfeeding messages when they were going through that, and lots of other stuff. In the center here, you see a very successful breast friend support group run by our wonderful Brandy Gates. I always say she's the Brandy Gates Burgess, award-winning IBCLC. And so, again, the task force goes on. They do a lot of work in social media, outreach, events, event planning. They have the Black Breastfeeding Week at the end of August. They've got a peer counseling program coming up. They're so super active and wonderful. So, and then they are a part of our coalition, but they have their own space as well.
So another task force within our coalition is the Asian Southeast Asian Pacific Islander Task Force, and we call ourselves ASAP with the exclamation mark as the upside down I. So that kind of explains it. We always get that question. So how this began, in 2014, this really came out of WIC outreach. Looking at, we had talked earlier about looking at the data for Asian American and Pacific Islanders and, early supplementation rates and everything. So we really wanted to start out and reach out to providers. We ended up doing a talk and tea kind of in the bottom left. That's our flyer for our talk and tea. And that was literally what it was. We all came together and we talked and we had tea and refreshments. And we really had good representation across our community. Like this was not just a bunch of, breastfeeding advocates, sitting around the table
Board
talking.
Of supervisors.
Right.
Yeah.
First 5 community health centers. WIC, of course, was there. And then so from that talk and tea, we went through this process of just kind of writing down what are the issues that we're seeing in our community, what should our priorities be, and then just doing, same thing like a sticky board,
organizing it into
rank
areas,
order, organizing it into kind of rough areas as a group, what are our rough priority areas. And then we took those priorities and we brought them back to the coalition, just to get kind of additional feedback from that group, because not everybody on the coalition was at the talk and tea, of course. So from that, we honed down a list of priority areas. And I'm not going to go into a lot of detail about that. We did, Jean and I presented during the Racial Equity Webinar Series back in May of 2018. So if you want more information about ASAP and kind of
check out that video. That's such a great resource to have that webinar series available in that library. So awesome. And then just very briefly, they really are integrated, but there's a big movement within Alameda County for the father-friendly principles. So really making sure that all of our programs and services are really inclusive of the needs of fathers, that it's positive father imagery, creating positions specifically to serve fathers, kind of like what we did with having Melvin be part of our steering committee leadership. And then really designing programs with fathers in mind. There's Tanya, myself, and Ruth, who's another steering committee member, at the recent Fatherhood Summit, which was incredible. And there's a link you'll have in the PDF to the Father Initiative if you want to download these posters and information to find out more about father-friendly principles and how you can implement them within your practices. And then, so how do we do what we do? Why do we know? What does that, well, we looked at those, again, those 9 top areas, and then looked at what's coming up in our hot topics and who's available to do what. And so, for example, California has developed and published and is promoting the 9 steps to breastfeeding friendly for community health care centers and outpatient care settings. This is very similar to the baby friendly or the 10 steps, and this is for health centers. So as I mentioned before, we have 8 vibrant community healthcare centers. We start with kind of are they promoting lactation accommodation? Are all of the employees that work with the health centers, are they supported? Because there's a lot of childbearing women there, tens of thousands across our health centers. And so we have one that's the Community Healthcare Center Lactation Accommodation Initiative. We also, from our lactation accommodation work, which we'll talk about in a minute, developed the Breastfeeding Friendly Childcare. So that's an ongoing subcommittee to support the child care centers in being able to do their quality improvement. And then we have an outreach and communication. So we did a library display. So we had a kind of a all county, not every single library, but we had dozens of libraries participate. And we created these packets, sort of like we had a general structure. We created lots of information with the pictures and stuff. So we had these packets. And then just volunteers in the coalition said, oh, I'll do my library. And they did it. There's like every single one looks a little bit different. But that was for World Breastfeeding Week that we talked about. That chain of support was the theme, I think, right? And then we have our newsletter. And then our other subcommittee currently going on is breastfeeding friendly birth control, because that arose not from those 9 top ones. Birth control wasn't directly mentioned, but that consistent messaging and education, we saw that there really was not good information out there across the board with our providers about breastfeeding friendly birth control and awareness of that. So we formed a committee in response to an identified need that came with that.
So Jean listed off all the different subcommittees that we have. Here is just an example of a subcommittee description. So we put together a specific purpose for the subcommittee. Who do we want to see on the subcommittee? So in this case, this is breastfeeding friendly childcare. We have the purpose outlined. Who do we want to see on this committee? Ideally, we'd want somebody from a local childcare organization, for example, as one of the co-chairs. And then expected time commitment, and then a steering committee contact. So every one of our steering committees has committed to co-chairing one of these subcommittees, right, just to make sure that there's continuity, there's connection back to the steering committee, and just the overall leadership. But anyway, yeah. So that's
every project subcommittee has a clear description, right, that people know what they're signing up for. Can they make that commitment? So there's a point person on the steering committee for that, but then there's always another co-chair developed that's more in touch with, or maybe an expert for that area.
Right.
I do want to I know we put a check-in here, but I also want to give some examples of how we put it all together, because I'm mindful of the time. So we will have time for questions at the end. So let's give some examples of how we put it all together. Like someone said, how do you know what to do or put it together? So let's take, this is us down in the right-hand corner. We actually won an award for our work, the Supporting Breastfeeding Families Toolkit for Childcare Providers. We won the California Golden Nugget Award. And so how did it all come about? Well, around this time, it was about 2014, really, we were doing all this kind of change in our structure. We got more people coming. A lot of childcare folks were coming. And they're like, what can we do to support? What can we do to support? And at that time, I was approached by the legislative coordinator for Keith Carson's office. He's one of our Alameda County Board of Supervisors. They wanted to do something around lactation accommodation. So we saw this need of childcare people that wanted some structure or resources to support staff trainings. And then we pitched a proposal for Measure A funds through the Board of Supervisors to say, because we could define, we had the data that could say this is going to reach, tens of thousands, ultimately hundreds of thousands of Alameda County residents who are part of childcare, and so we really do need to address this and develop these guidelines. So we did win the funds for that. We developed a toolkit in English, Spanish, and Chinese, so we published it in 3 languages. It's available online, so you can get it from our Alameda County Breastfeeding Coalition website, which we'll give you at the end. We also developed magnets, again, in the 3 languages. The important thing about this is it wasn't just our thing that we cooked up as a coalition. We actually worked with the Department of Education and Department of Child Care Licensing. So we brought in the experts, and together we collaborated in the development. And you could see some of the logos that represent, the participation there. We also, with the Department of Education and Child Care Licensing, developed a 1-hour training webinar. There's one point of information that we do need to update on that, but we'll put that as an attachment. But there it sits, free. You're out there, you're going to do your staff training once a year or whatever about this, or new employees come on, you want to give them, it's there ready for you to access and up to date with California standards. So it's kind of like that storm, norm, form, whatever, that kind of thing, and how it all comes together.
And just to mention, that webinar is, just really quick, it's geared towards child care providers.
Both family-based and center-based.
Yeah,
it includes both. Yeah,
right.
Very important. Another example along that community healthcare center lactation accommodation, Tanya connected with Martin Otero, who's our outreach specialist locally for the Department of Labor Wage and Hour, and he wanted to come and do a presentation at one of our meetings to the coalition membership, because he said, you all know what's going on. Like, you would know how to support families and can get them connected with us as a resource for supporting employers. There's a great response to that. Here's an example of the agenda that we had for that, in which we had this education forum with Martin, and then we had other business to attend to. But from that, there was such an interest that actually we were able to get through our community healthcare centers, Martin, to do a presentation at their regional meeting for their HR folks. So that's coming up April 1st. We're really excited about that. And then we're following it up with kind of a bigger session that's inviting more employers and human resource professionals that we're working on as a coalition. It's not our usual coalition meeting. It's a special event, and we're bringing in others to give them resources in response to that support and continuity. And then just very quickly, we also, as part of our communication strategies, worked with the public health department to have a web page within the public health department just on breastfeeding, which has lots of different dimensions. It's acbreastfeeds.org. You can check it out. We were then able to, again, we have resources there that then we can link to, in addition to our California Breastfeeding Coalition web page, which has our coalition site. We have lots of other resources that represent the broader county and information, so you can check that out there. And we developed sort of like our support guide. What are the basic phone numbers? What are some tips and links? And then, a free QR code that we can put on our materials that people can scan and go to that information to get more. So in summary,
I know we blew through things very quickly.
We have plenty of time for questions, not to worry. So that data. So kind of know who your people are, and maybe give some clues as to, who is in your community, what might some of their needs be. You might do maybe more of an assessment. What's your mission, and is your mission aligned with your community and their needs? And is it like what we're working on? Can anybody say it? Does everybody know? Is everybody behind that mission? Look at yourselves as an organization, and there's always room for improvement, right? We're always trying to improve. And then also, how are you aligned with your community needs? So whatever way that you can work on community assessment. We were fortunate in being able to align with the public health departments. That might be an opportunity for you, because they do have to do that every few years. Is your leadership and organization, in line with, what you need to accomplish? For us, it was co-chairs, steering committee, special subcommittees, and then also project subcommittees. And then, really, really just making it happen, those project subcommittees. So, all right, Danae, we'll let you just hit us with all the questions that are waiting out there.
Well, first of all, thank you for such an amazing, amazing presentation. We do have questions. So the first question is, what % of your grants go towards stipends and employment?
Different grants, different things. For example, the Oakland Breastfeeding Promotion Project, we had 3 years of that grant from Kaiser. There was a little bit of that funding. It was a while back now. I'm trying to remember. I don't remember the exact amount. I think the first year we got $25,000, and it was $20,000, then $15,000 or something like that, as they were weaning off that funding stream. The majority of it went for the salaries for the IBCLCs. We had some funds for food for all the meetings that we had with the staff, and then a little bit for materials. But the majority of those grants were really about getting the lactation consultants there to do the training, to do the support, to do the development behind the scenes for all of that. Same thing with the NACHO grant. There were different parts of that grant. So it was kind of like an 18-month grant. There was a half year, and then there was a year. So in the half year, we did a lot of development on that curriculum development. So we actually paid the consultants, if you will, for their time in putting together 2 different things. It was messaging for the Black Infant Health Program, and then we developed a group facilitation structure. So those African American lactation consultants were paid through the grant to do that work. And then we implemented the support groups. Oh, and the peer counseling training as well. That was another measure. So we trained, it was a dozen African American and Pacific Islander, I guess they work with, they were community members. They were also health workers, but they did the peer counseling program that was led by our African American lactation consultants to, develop that within the Nature Grant. And then the second year was about actually rolling out the support groups in East Oakland. So that was, food, some materials, some stipends for moms. We did also the focus groups that was stipends for the moms. We paid them really well. It was like, I think, $150 stipend to participate in the focus groups, and we had 3 of them. So they were, there was a lot there. So for food and stuff. So I'd say that it all went to the paying for the lactation consultants, and then also the stipends for the mothers to participate. And it was all stipends, right? And then food and stuff. So.
Great, thank you so much. Who manages your grants? For example, do you have an individual, a group of individuals, or a different sort of system in managing those?
That's a great question. I think for the most part, you talk about accessing different people's skill sets, and I seem to have been the one that does. I'm a pretty good writer, so I find these grants and I pitch them to the group. Like, for example, I came to BCOT, participating in BCOT, and then came up with this, and then together we worked on what that would look like. The health center itself, West Oakland Health Center, was the agency that received the funds. So I could pitch it, I can work to support it, and I can work with their grant writer to write that grant in a way that is acceptable for them. Same thing with the NACHO grant. We brought in, first 5 perinatal services, maternal child health. We had a lot of players at the table that came up with, well, what do we want to do and how do we want to do it? So they kind of formed it together. And then we have for Alameda County, there's a grant administrator that helped put together the different pieces of that grant. For the Measure A funds, pretty much, I wrote it. And there's a lot of reporting with Measure A funds, be warned. But we all worked on what we wanted to do, the toolkit and stuff like that. So the planning was together. I was the key writer. I don't know, we've had a couple of different little grants that we've gotten from Kaiser for events and things like that. They're pretty easy to knock off. And so, that's kind of it. So no one person does it alone. You have to think about who you're working with and what their ownership is. And then so far I have been the primary person, but I'm sure that there are other people in our coalition that we will be developing to do more.
Great. Next question is, have you been able to reach physicians to support your coalition efforts, such as a champion within hospitals who you can use to help support and identify barriers among other physician colleagues?
So I'll take that one. I mean, the regional hospital task force, I think, was the opportunity that we had the most physician participation. Again, it was really structured in a way. We rotated from hospital to hospital. We structured the agendas and the education points, and we encouraged their participation. We had a lot of pediatricians and OB representatives that then said, hey, this is really good. Will you come to our next joint staff meeting and come give a presentation, or they would take it back, or it would inspire them to do stuff. I'd say that how often physicians show up at our quarterly coalition meetings is relatively low.
Right.
We get more nurses and lactation consultants, lactation consultants, public health nurses, physicians less so. And I think that that's, again, why we're trying to expand a little bit into the education forum. Right. It's about like the way that the hospital task force, that subcommittee, that might be really something to look at, is how they structure. You have to really talk fast and cover a lot, but leave room for participation. I guess it's a little bit different structure for a meeting that tends to draw the physicians in those, like, we're working on this project, we need you to participate, that kind of thing. But I know other coalitions have physicians come. Some even have a leadership role in that. Mm-hmm. So definitely an area to see more participation for the midwives and physicians, for sure.
Thank you. Has the coalition done any work promoting policies around breastfeeding in your state?
In our
what?
In our state, is that what you said?
Yes.
Oh, policies within our state. I mean, during our, we haven't done any formal campaigns. As part of our meeting every quarter, we do have policy updates, legislative updates. So we do have a steering committee member who brings that information to the larger group. You know, on the statewide level, we're involved with the California Breastfeeding Coalition. You know, but,
so we have a steering committee member that has agreed to be that point person. We used to have one of the co-chairs back when all these changes were going on. She was part of all kinds of national campaigns and things like that. But what we do at best is probably like we have something, here's an action item, write letters to, you know, it's in this committee, that committee, and then it would go out to the membership. We've been talking as a steering committee trying to formalize that more, just like with our other project subcommittees, so that there's some sort of expectation for who will be doing that work and sending it out to everyone, or what we could do. But again, another area.
It's another area that we want to, you know, move further into. So again, our list is very long.
But so locally, right, our policies and practices locally has been more of our focus, helping hospitals implement baby-friendly hospital practice or California model policy, our community healthcare centers, our programs, our WIC programs, our public health. So we've been kind of more locally focused, for sure.
Great, thank you so much. So can you share any tips or best practices in keeping your volunteers motivated and engaged, and any best practices around how to handle turnover?
Well, I mean, like, we all have real lives, and I think we all are very compassionate with each other as far as, like, you know, you stepped up to do something, but then life happened. And I think that's why it's really valuable to have many hands make light work, and not, because we really do need to be responsive. So give lots of opportunity for people to participate, understand if they can't. I mean, as far as the transitions and things go, for example, sometimes people stay on longer with the understanding that our goal is to always have new leadership come in, but sometimes maybe we're in the middle of a project, so somebody stays on or nobody steps up. So we try to stay fluid, I guess would be the tip, is try to stay fluid, and make sure that nobody gets burned out.
Right.
Like, by creating these subcommittees and sharing the work, hopefully the small group, we've actually grown. So our small group of committed people has grown stronger and is able to engage more people in projects that are meaningful to them, while also, and then we just do a lot of celebrating. I think we try to, you know, when we have these celebrations, we have raffles and we have prizes and give certificates and things that just say, yay, you.
Yeah. So, you know, we really tried to build in, that was the whole purpose of having the steering committee and the subcommittees and everything. So nobody feels like they have to do it alone.
Or take it all on.
Right. And so there's, you know, we're trying to build in a lot of support, and also really try to appeal to, you know, what are people interested in doing, you know, and how can we, if you're interested in addressing lactation accommodation, you know, how can we bring you into the fold? What can we do, you know, to support you?
And I think we're lucky. I mean, there's always drama in any group of anything, right? I think I have to say, just from my perspective, not that we haven't had some, but I think everyone's really committed to not letting that get toxic, and trying to address it. So there have been stuff that have come up that, you know, the chairs actually, you know, talk to this person, talk to that person, not to try to meddle or something, but just like, let's find a solution that we can still move forward and be inclusive. But I'd say we're pretty lucky. We have a pretty low drama thing. So we just want to really appreciate people, and not take a hard line like, oh, she never shows up for meetings, like, forget about her. No, you're still included. And that's why even with our newsletter, we know you can't come to all these meetings. People get meeting to death. So we want to keep you in touch. And we're having such a great response to this newsletter that we're actually increasing and expanding our membership, which is wonderful. So make it user-friendly.
Wonderful tips. Thank you so much. We have one last question, and that is, could you give Martin's contact info from L&I again?
Sure. So if you go to the Alameda County Public Health Department website, that's acphd.org, and then you'll look under programs and services, you'll see fatherhood, and that's the connection with the Fatherhood Initiative. I'm happy to send out, let's see, I think it's Melvin Calloway, so MELVIN. I want to make sure I got the spelling right. Check that spelling. But it's in Alameda County, it's first name dot last name at acgov.org. So you can see, like on mine there, it's jean.kettles@acgov.org. I believe, and we're opening our emails right now. Just check on Callaway, make sure we got it correct. But it's Melvin, MELVIN CALAWAY. So MELVIN.CALAWAY at acgov.org.
Wonderful.
And there's our contacts if you want to contact us, and there's our Alameda County Breastfeeding Coalition page as part of the state coalition network of coalitions. And then you also saw that acbreastfeeds.org. That's another way to connect with us. And that's a growing site.
And was Melvin the labor and industry gentleman that you
No, Melvin is the Fatherhood Initiative. So he's our Fatherhood Initiative liaison. He's on our steering committee. If you are looking for Martin Otero, is the Department of Labor. And Tanya's bringing that up right now.
Give me a second, and I will find his contact information.
And there are, so he is community outreach. So what they do, and they've been actually really active across the state of California. I'm sure you have them in your state, wherever you may be. But there's two, so there's like enforcement, and then there's community outreach. So Martin's approach is more educational, supportive, outreach. Let's try to work out a solution. Let's try to prevent stuff. And then if that doesn't work, then it goes reported to enforcement, So he's a really great connection. You got it?
Yep, I got it. So his email is otero.martin, MARTIN, so kind of backwards from Alameda County, at dol.gov.
Otero.martin@dol.gov.
Okay, and I just chatted that out for everyone to copy.
Oh, perfect. Thank you.
Mm-hmm. All right, ladies, thank you so much. We are going to switch over very quickly for some quick updates from USBC. Alyssa Spees, our Constellation manager, is going to share some updates about a couple of sign-on letters opportunities from USBC. So I will go ahead and unmute her. And Alyssa, you are on.
Thanks, Danae. Hey, everyone. Like Danae said, we have 2 sign-on letter opportunities that are out now. And they are a sign-on letter requesting, it's for the federal fiscal year 2020 appropriations request that we submitted this request for at least $13 million to the CDC breastfeeding programs. And so we ask organizations to sign on to help support that request to get more funding put towards, the great programs that help support breastfeeding across the nation. The second letter is the Fairness for Breastfeeding Mothers Act. And this bill was introduced and passed in the House, and right now it is in a Senate committee. And the bill would require that certain public buildings have a lactation space. So it's not a bathroom, that it's hygienic and available for use by members of the public. So specific buildings would have this requirement. And so it was introduced in the House and passed. And so this letter, the sign-on letter, is urging the committee members in the Senate to discharge the bill from committee so that it can go to the Senate floor for a vote. So we think that this could be a great win for the first food field and breastfeeding advocates. And the deadline to sign on for both of these letters is Friday, March 29th. The links for these letters went out to our members list. We'll make sure it goes out to our coalitions list. And they were also shared on our Facebook page earlier today. So we hope that you all will take a look at these sign-on opportunities and help us, reach out and get, federal support for breastfeeding. So thanks, Danae.
All right. Thanks so much, Alyssa. Our next update is regarding the National Breastfeeding Conference and convening. So we wanted to let everyone know and make sure that you know that registration for the conference is now open. So you can find info about registration, exhibiting and marketing opportunities, the hotel, and the preliminary program on the website. So to stay up to date on the NBCC, please follow the event on Facebook. We will make sure that we get these links chatted out to you. Miriam, if you could chat both of these links out, that'd be great. And if you have any questions about the conference or registration, please feel free to email conference@usbreastfeeding.org. So that brings us to the end of today's session. Thank you again, Jeannie and Tanya, for such an amazing presentation and bringing some best practices from your experiences. Your presentation really showed that when coalitions utilize the expertise, the time and talents of their volunteer membership smartly, coalitions are definitely able to scale their impact and create a landscape of breastfeeding support. So we thank you all for everything that you do. Please feel free to complete the survey and get a certificate of attendance for today's webinar. We will see you soon. Thanks so much. Bye-bye.
Thanks for the opportunity. Bye.